Today, we're going to talk about the continuum of care and addiction treatment and why it's so important. In this video, I'm really going to discuss the continuum of care in a general sense. In a later video, I will talk more about the ASAM levels of care and how we might determine which level of care is appropriate for a client. As therapists, one of our jobs is to assess our clients and determine what level of care is most appropriate for our clients. Now, in this video today, I'm not going to go into all of the detail about the different levels of care. However, I am going to generally talk about the continuum of care and what it is and why it's so important in addiction counseling, but in counseling in general. So, when I talk about the continuum of care, this refers to a structured system of treatment and recovery services that provide ongoing step by step support as a person's needs change over time. So, the first thing that we would take into consideration here is the level of treatment intensity. So, there are many different levels of care in addiction counseling or in addiction treatment. In a high intensity level of care, we might see something like withdrawal management or detox, inpatient treatment, residential treatment, so on and so forth. On our lower levels of care, we might see something like intensive outpatient treatment, traditional outpatient treatment, or even individual counseling or group counseling. We might see something like that. And depending on the client's needs in different areas of life, they are going to be placed in one of these different levels of care. So, the second thing that we would want to consider here is ongoing support and transitions. So, something that's really important to say about the continuum of care is it's meant to be kind of continuous and it changes as the client's needs change. So, what I kind of mean by that is say that a client's in treatment and they're doing really, really well. They're meeting all of their goals, they're stabilizing in treatment. Typically, what we'll see is a step down in treatment over time. So, maybe they started an inpatient treatment and they step down to a residential treatment, and then they step down into an outpatient treatment, and then they discharge from outpatient into their own counseling. That is just an example. As they stabilize, they go down these different levels of care, and because their needs are changing over time. Now, what happens if someone is in residential treatment? Maybe they stabilize, so they step down into outpatient treatment, but then they experience a big relapse. Or they start to exhibit maybe some thoughts or behaviors that might be indicative that a relapse might be in the near future. So that means that this person's needs have now changed. They have increased. So that means that we probably need the level of care to potentially increase. So maybe this person had dropped down from residential into outpatient care. Maybe they need to come back up into residential because their needs have increased, their needs have changed. And so we want to meet the client where they're at. So generally speaking, the continuum of care is meant to be, as someone stabilizes, they kind of go down in that level in those levels of care, and as needs start to increase, if they do increase, they can step back up into different levels of care as their needs change. The other thing I want to mention about continuum of care is this is meant to be a holistic or a long-term approach. So, what happens after someone goes through seemingly all the different levels of care? They started in detox or withdrawal management, they went to inpatient, they went to residential, they went down to outpatient, and now they're seemingly done with their treatment. Something else that we take into consideration with our continuum of care is what additional supports does a client need in order to be successful in their care. So, an example of this might be maybe they need some extra support through the 12-step community, like AA, NA, something like that. Maybe they start working with a sponsor. Maybe we suggest that they need some additional case management because they have a lot of health issues that are going on and they need some additional support. Maybe they've experienced homelessness throughout this process and need some case management support to help them get some housing, to get some stable housing. They might need some vocational training or some career counseling. Maybe they need some additional relapse prevention planning. Maybe we could connect them with some support groups in the community. So the continuum of care, although we do focus a lot on those specific levels of care like withdrawal management, inpatient, residential, outpatient. There's also these other resources that we want to help our clients to get connected with that are beyond just your structured treatment programs that are out there. So, really, the continuum of care is about meeting people where they're at. It's about providing the right level of care at the right time. It's about maintaining recovery as a lifelong journey, not just as a 30-day treatment program or a 60-day treatment stint. We really want recovery to be a lifelong success for our clients. So, thanks for joining me today to talk a little bit about the continuum of care. I'll see you next time on Therapist Things with Dr. King.